Hey, renal responders and fluid balance warriors. Have you ever seen tea-colored urine and sudden puffiness in a young patient after a sore throat? It could be more than dehydration. It might be acute glomerulonephritis, a condition where inflamed glomeruli can quietly disrupt the body's filter system. Let's break down what causes it, how to recognize it, and what nurses must watch for in care and education. Acute glomerulonephritis is inflammation of the glomeruli, the tiny filters in the kidneys that remove waste from blood. It's often triggered by an immune response following an infection, especially group A streptococcal throat or skin infections. So, here's what happens. Immune complexes deposit in the glomeruli, which causes inflammation and thickening. This results in reduced filtration, hematuria, and fluid overload. Alright, here's what to look for. Hematuria, which shows up as tea or cola-colored urine, proteinuria that makes urine look foamy, facial and periorbital edema especially in the morning, hypertension due to fluid retention, oliguria or decreased urine output, and sometimes fatigue, malaise, or a mild fever. So, when it comes to diagnosing glomerulonephritis, we usually start with a urinalysis to look for things like hematuria, proteinuria, and those classic red blood cell casts. Next, blood tests are important, especially to check for elevated BUN and creatinine levels, which can indicate how well the kidneys are functioning. An ASO titer might be ordered too, to help identify if there's been a recent streptococcal infection. And, in cases where the diagnosis isn't totally clear, a renal ultrasound or even a biopsy could be considered. So let's talk about treating the underlying cause. For active strep infections, or when an infection just won't clear up, antibiotics are the first step. If inflammation is more severe, or if it's related to an autoimmune process, corticosteroids can help reduce that swelling. We also use antihypertensives and diuretics to manage blood pressure and help control edema. Sometimes restricting fluids and sodium is necessary to prevent fluid overload. And in rare cases where there's severe acute kidney injury, dialysis might be needed. Monitoring fluid status is super important, so that means accurate daily weights, strict intake and output measurements, and keeping an eye out for signs of fluid overload, like crackles in the lungs or shortness of breath. Blood pressure checks are another key part. Monitor closely, give antihypertensives as ordered, and make sure families know how to check blood pressure at home if needed. For edema management, elevating limbs helps, and teaching about a low-sodium diet is crucial. Don't forget to assess for skin breakdown or discomfort too. Patient and family education is huge. Stress the importance of finishing all antibiotics for strep, explain the need for follow-up labs to check kidney recovery, and remind them to limit fluid and sodium intake while avoiding nephrotoxic medications. And reassure everyone. Most cases resolve fully with proper care, but follow-up is absolutely key. Acute glomerulonephritis is usually temporary, but, its complications can be pretty serious. Nurses play a critical role in catching the signs early, protecting kidney function, and empowering patients as they recover. Have you cared for a patient with acute glomerulonephritis? Feel free to share your fluid and blood pressure monitoring tips below. Subscribe and follow for more renal health updates, because nurses keep kidneys flowing strong.